Hi, everyone. Welcome to OBGYNs for Sustainability quarterly webinar. I'm here joined by my co-founder, Dr. Ali Melnick, researcher extraordinaire now at the Cleveland Clinic in female pelvic medicine. I'm Dr. Jane Van Dis, and I'm an OB hospitalist at the University of Rochester. And we're really excited to be joined today by Dr. Lisa Patel. She's one of the preeminent figures in the movement to help educate clinicians about the climate crisis, about the intersection of climate health and population health, and the role that healthcare providers and health systems can play in helping to decarbonize medicine, which is responsible, depending on which study you look at, anywhere from 8 to 10% of all US greenhouse gas emissions. And so a little bit about Dr. Patel. She's the executive director at the Medical Consortium on Climate and Health. And this is the organization of medical specialties that are organizing around climate and health. She's also an associate professor of pediatrics at Stanford, and she's the executive committee member and co-chair for the American Academy of Pediatrics Climate and Health Task Force. And lastly, but not insignificantly, she's also mother to 2 young children. And I don't know if I saw that on the internet, how young they still are, or if that's still in full force.
It sure is. It was a comedy of errors this morning. My husband's out of town. I'm walking them both to school. One starts vomiting.
Oh, gosh.
So I'm so sorry that I'm late. My apologies. Thank you for your patience.
Not at all.
Thank you for joining us.
Yeah, we're so excited to have you here. And we're joined here by Irene Komarinsky. Yes, she's coming in from Connecticut. But of course, Dr. Patel will be putting this webinar up on our website, and lots of people view them after we record them. Obviously, in the middle of a work day, sometimes it's hard to get away.
Yeah, I'm excited to be here. Thank you so much for having me.
Yeah. So one of the questions that I wanted to start out with is just a little bit of a description about your journey in becoming an activist, scholar, and organizer in the healthcare and climate space. Can you tell us a little bit about your journey to be here today?
Yeah, my father's a doctor, and so and I was good at science, so there was always the expectation that I was going to become a doctor. But as post-adolescent brains sometimes do, I decided to rebel, and I was introduced to Carl Sagan and got really in love with the idea of, not the idea, but the ethos that he created, that our world is so special and unique, and it is worth fighting and saving for. And so I studied ecology and evolution in college, and then became an environmental scientist. But while I was in the middle of that, I realized I felt like I needed to do something that was more service oriented. So I sort of pivoted and went back to the expectation of becoming a physician, and spun a good enough story to where I got into medical school. I couldn't have told you in the early 2000s. I don't know that I had a great story as to how it all went together then. But I came out of medical training. I figured I'd have a couple of years. I was a new mom and a new attending, and I really wanted to focus on that. And because I had studied climate change in college, I had figured, I'm like, there's no way any reasonable leader or adult would look at this evidence and not act to prevent the worst effects of climate change. And then when we withdrew from the Paris Climate Accords in 2017, it was this shock to my system, like, oh my God, that is completely possible. We are completely willing to drive ourselves off a cliff. And so I didn't know where to start. I didn't know where to begin. And so I started with my society, which is the American Academy of Pediatrics, to learn some advocacy skills. Kept looking for my climate change community, but just couldn't really find it. I didn't want to just do research. I wanted to do activism. And then in 2019, the youth movement started. And I feel like the youth movement was really galvanizing for people across all of our society. And suddenly there was like a group of students, of faculty, of students in Northern California where I live, And I got started. It was really easy from there, and just a really fulfilling community to be a part of.
And can you speak a little bit on when you worked as an environmental scientist, what you were working on?
Yeah, I started working actually on tropical deforestation. I was looking at community-based solutions to preserve tropical forests. And what I kind of quickly realized is that whatever we said, however much we claimed we cared about ecosystems, we weren't really putting the policies in place to protect them. And so part of me was thinking that if I really wanted to save this world, I needed to connect it to the people. And not to say I have a deep and abiding love for land and how it determines our health as well, but it was really more of a strategic decision to think, well, if I really want to be able to make the case for why this should matter to us, I think I need to make it a case about us. So I worked in tropical deforestation. Then I sort of pivoted when I was thinking about medical school to working on clean air and clean water projects with the Environmental Protection Agency, and doing that work at the more of the direct intersection between environmental pollution, climate change, and health. That decided it for me.
Wow. And then just a little segment on how you did you help to found the medical consortium?
Oh, no.
Oh, okay.
That was Mona Sarfati. She previously worked for Ted Kennedy's office. So she had spent many years on the Hill. And she retired. And as I'm learning, retirees in the space they don't actually retire. They then take on second and third careers. And so Mona, in her retirement, really had come to understand that climate change was going to be and already is really profoundly determining people's health. And we as health professionals and medical societies weren't paying enough attention or doing enough work in the space. So she met Ed Myback at a time when Ed Myback, who'd been long been doing communications research in the public health space, had started doing more work in the climate change space. And his research was showing that the health message was the most activating and it was the most depolarizing, and that professionals were the most potent messengers. And so if you could put those two things together, get health messengers to talk about climate change, that it was a hugely winning combination. So they met, and Ed said, come into my center, start the program. And that was how the consortium was founded.
Wow. One more question and then I'll turn it over to Allie. But when you took it on this role of executive director, did you have a vision for, where you wanted the consortium to go, or some concrete goals that you wanted to achieve in your leadership there?
Oh, yes, definitely. And I really credit the students that I worked with at the very beginning when I began my path of activism. I wanted to make us much more intergenerational than we were. I wanted to make us much more diverse than we were, both in terms of talking about individual identities and talking about different types of health professionals. I think there's this idea that, and physicians, we don't like to say it out loud, but at times we do feel rather self-important. And but the reality is that nurses are more trusted than us, and pharmacists aren't that far behind. And there just aren't, in the end, there are not going to be enough doctors to carry this message for how many places we need this message carried. And so another goal of mine, there are a number of thriving organizations. And so trying to come up with ways to collaborate closely with, for example, the Alliance of Nurses for a Healthy Environment, and helping to facilitate these emerging groups. There's this great group, Pharmacists for Climate Action and Occupational Therapists for Climate Action, and really helping each of these groups recruit more and more members so that we could be a united coalition of health professionals for climate action.
Wow, I love that. I love that. I feel like when I'm thinking about the types of changes that I'd like to see at my own institution, I know that part of the success of any initiative will hopefully involve, multiple different types of backgrounds and licenses. But it can be hard just when you don't know anyone that is interested at your own institution to find people in those other groups. I love that that's a goal that you have. Allie, I'll turn it over to you.
Yeah, I mean, that's a perfect segue. I feel like I've been trying to recruit others by doing, and when they see and like in the process of carrying out projects and research, that's when so much education happens, like in my space of the operating room in particular, and people are motivated. But I can't say that at my institutions that there are, like a nurses group or, other staff members. And so that is absolutely something that we can start. People are interested, but creating those coalitions. And that was a question that I wanted to actually ask, more kind of in terms of getting clinicians activated in AAP, what have you found to be most helpful? And then what has been the hardest in terms of getting your messaging out and getting other people in your organization?
I think the visibility really matters. I mean, what really struck me is it took me 2 or 3 years of really trying, right? But our voices were so disconnected and there were plenty of other people that cared. It's just that we didn't have some common place to come around, and we didn't have some common thing to be working on. But as soon as we had that thing, and it was the moral clarity of the youth movement that I think brought everybody out. We had a shared purpose, and then it just felt easy. It felt very natural. To your point, Allie, about like doing and then getting other people to see it, it's so powerful. So 5 years ago, I was able to accomplish with the students. 5 years ago, Stanford did not so much as have, it had like one sustainability person who was treated really more like a consultant, but there was no sustainability mission. And now 5 years later, Stanford is being lauded by JACO as the model. And what really struck me, we did a lot of organizing work when the pandemic started to enter a dialogue with our CEO and facilitated a dialogue between our CEO and the other CEOs in the Bay Area. And we are very fortunate that our CEO is really thoughtful. And so when he entered that dialogue and sort of realized that there was a big potential here, it was just been incredible to me. Before, when we started, we were talking about doing like a sustainable gowns project. That's where we started, and we got nowhere. We couldn't convince anybody within our institutions or systems. We felt really lonely. And then once leadership was on board, it was a year or last year, I went to the launch of the formal sustainability program, and they had this organizational chart up of all the people across all the departments that were signing up to be a part of the sustainability plan. They're there. It's just, we need to create, I feel like it has to be both things. There needs to be something from leadership that says that this is a value, plus, and create some structure for it. Plus there need to be people that are showing how it is done. And when that happens, oh my God, it moves so fast. It's just been incredible to see.
Well, go ahead, Allie.
I love that, because I feel like I say that. I feel like it's, you have to have people on the ground. Everybody, every OBGYN can do something, something in their clinical practice every day. However, you need that leadership support. You need people in all of the departments to care and to also do things. So I love hearing that in an, entirely different specialty that, this is important. I feel like it's a pipeline dream to have everybody in all the divisions, like a sustainability champion or, a leader of some sorts, to make sure that the MFMs are doing it and the Eurogyns are doing it, the ONCs. Doing it, meaning there's so many things, obviously, but it's really nice to hear that elsewhere.
Yeah.
Well, the question I had was a follow-up, Lisa, and that is, when people come to the consortium, whatever specialty they're in, but they don't have that leadership piece, either from their chair or from their CMO or CEO, what is your advice?
My advice is to start organizing, right? Because I can't, right, there are some leaders that are more responsive and thoughtful to what their employees want. There are others that perhaps have more competing interests, that may not be as responsive. But it's certainly not a bad place to start, and start with a good faith that your leader does care what your employees want. And so, and I think, we are lucky. We have a very thoughtful leader. And so it didn't take much, but well, not that it didn't take much. it took probably 20 to 40 hours of organizing per week to put on the symposium that we did to show, right? And our leader doesn't know that, but we put in a lot to organize the symposium with the other academic centers to show a really good faith of like, this is how invested we are in this. We got 700 people to sign up to come to this symposium. So we really showed the numbers. And that just takes some work and some organizing. But it's really hard to say that this isn't a priority or this isn't important when you show the numbers that way to your leader. But it does take some good organizing work and some strategic organizing work to figure out how you show those numbers to your leadership. We're actually at the consortium right now, we have a brand new healthcare decarbonization group. And we're sort of pulling together an activation guide, building from different models of stories that have worked in different places. So we used a symposium at Stanford, for example, to enter a dialogue with our CEO. Another center organized a letter. Another center worked with maintenance staff to get them to show up to staff meetings to talk about how much waste they were seeing and how they didn't want to participate in this, right? Like there are so many different ways that you can do this. It really just depends on the culture of your institution, unfortunately, the politics of the state in which you are, and the culture of your leadership. And there are ways to do this, but you just have to apply some strategy to it. And we're hoping at the consortium to build the resources to help you think about what that strategy might be.
Yeah. I have a follow-up on my follow-up, and that is, you know, the leadership, obviously, let's pray and hope that they will listen to their constituents if their constituents organize effectively and have good messaging and have projects that are quote unquote doable or reachable. But another way that leadership might get interested and activated would be if organizations above leadership, like JCO, like CMS, where is the consortium at, and what do you know? I'm hoping you're going to spill some insider knowledge about when these major accrediting organizations will begin to hold healthcare accountable, because you know, if they're held accountable, then that's going to affect hopefully their bottom line or a metric that they have to meet, et cetera. What are your thoughts there?
So what I've heard happen, and this is all second and third hand because I was at the meeting, but what I've heard happened was JCO actually very much wanted to introduce sustainability as mandatory metrics. They heard a lot of opposition, particularly from medium and small hospitals that are really struggling financially, that they were going to leave JCO and they were going to go to another accrediting body. And JCO in the end is a membership body. And so the feeling was better that they stay with us than they go to another accrediting body that isn't going to try in any way to push them towards sustainability. So that's kind of where we are right now. It is a difficult, I mean, let's all be honest, like, right, we're all practicing physicians. And Irene, I heard you work for Stanford Healthcare. I work at Stanford Tri-Valley, where yet again, we're going through a fight about saving our pediatric ward because it is money losing. Every one of these small and medium-sized hospitals, they're struggling, right? Like, we're losing tons of people. There are cuts being made left and right. And so the way so a few things. Part of what our healthcare decarbonization group at Stanford is trying to do is to try to understand where our policy opportunities are. And we're going to have to do a both and approach. We need to build more will across our systems. We need to create greater consciousness that there are resources through the Inflation Reduction Act that will not last. And really create some materials. And we have a number of really thoughtful folks that are working on creating sort of packets and guides for how small and medium-sized hospitals can take advantage of Inflation Reduction Act dollars, because you do have to pay a lot in legal fees to navigate that legislation. But there are folks that are helping to create toolkits on how to do that. And then we need to build that will, and we're working on that piece, build the awareness. And then we also need to be thinking about the long game, which is policy. So be thinking about, can we start modeling some state level legislation? In California, for example, now all big hospital systems have to report their greenhouse gas reporting. for example? Are there other policy levers that we can use in other states to start building sort of, this state did it, we need to do that too? That's one possibility. CMS and JACO are another possibility. I think CMS is a more likely possibility than JACO. But we're going to be spending some time now in our group sort of thinking about, we were just getting this group and its advocacy aims launched, but we are sort of thinking about both the policy strategy and the on the ground, how do we build the political will at the same time?
Yeah. Can I ask, in California, did that come from the executive branch or the legislative branch?
Oh, so this is a long time coming, and it's not focused on healthcare, which is why I think my colleague Lisa Churchio tried to pass something in New Jersey to get healthcare centers to be mandatory reporting. And the state level hospital association there shut it down. It shut it down fast. Again, because they heard a lot from medium and small level hospitals that they didn't want any more onerous reporting requirements. The legislation that passed in California isn't by sector, it's by how much a business makes in profit. And so large, any business that makes a certain amount of money has to report. So that brings in all of these larger healthcare systems, and even ones that work nationally. If they operate in California, like Dignity, for example, they're going to have to start reporting their greenhouse gas emissions.
Amazing.
I mean, that's like great, and that should be happening. And like, in addition to CMS and JACO, like for me on my end, one of the big ones that I think about is the FDA. You know, there's not a lot of communication between all of these bodies, and there's a lot of people in these space, you know, in our space that, you know, some people with infection prevention, you know, might work with some groups, you know, I might work with another. But we all need to come together, and the FDA in particular, you know, we need physicians there, and that's personal. Like, I don't know how to get there. Like, that's like down the line.
I do, Allie. We've been invited to write a memo. Lisa Churchio was working on it.
Yeah.
Recommendations on healthcare sustainability involving the FDA. And if you'd like to join Lisa, please do.
Yes, I'm happy to. Because I feel like because that is, you know, the FDA, and, you know, approving new devices or making it easier to, you know, update old devices that are safe for reuse. Like, that is a huge area. And in my field of, you know, throwing away pessaries every day, it's just painful. Yes, sounds good. Offline, we can get information for that, because that is an area that, just like, you know, JACO and CMS, like, we should be a part of and a part of the conversation.
Yeah, absolutely.
I do want to pivot just a little bit about our conversation, because I know that you were at the most recent COP meeting.
Oh, I was not.
Oh, I thought you were. I'm sorry.
Yeah. Yeah, I can tell you what I've learned about it. I wanted to go, but I'm trying to be mindful. I do have 2 young kids. The more older they get, the more conscious they are that I'm away, unfortunately.
Fair enough.
So I'm trying to be very mindful of when I travel and for what purpose. And I didn't feel like this year I had a good purpose. I'm building towards next year. The COP is actually not going to have a health day. It's in Azerbaijan, but Brazil is going to have a health day in 2026. And so I'm going to Brazil, but we're going to start prepping for that right now. But I can potentially answer any second or third hand questions about COP.
Well, you know, from your, you know, leadership standpoint and everything that, you know, any key takeaways from COP, was what I wanted to talk to you about, if you know, were able to listen in and attend, you know, any of it. But
yeah, we actually had Dr. Jenny Miller, who leads the Global Climate and Health Alliance. She came and briefed the consortium, and she was really considered the big organizing force for the health voice at COP, a health professional voice at COP. And she felt a lot of energy after it. She said, you know, this is the first time that health had its own pavilion, which was huge. It's a little crazy to me that we're 28 COPs in, and finally, people understand, right? And
Right.
then too, there were commitments made to greater investments in health as it applied to climate. I haven't seen the subsequent news about how all of that is playing out, but those financial commitments also felt like they were a big step forward. The other thing, though, that Jenny pointed out to us was, I can't remember the exact number, but it was staggering. Thousands of oil lobbyists that were there. And so the influence of oil everywhere I look. So at Stanford, we're in the middle of trying to get Stanford to create guardrails around fossil fuel funding. And every time I hear about, our dean thinks that there's no conflict of interest in the name of academic freedom, we should be willing to take the money. It's not in any way, shape, or form influencing what the students are learning or how. His course,
Hashtag Hoover Institute.
huh?
I said hashtag Hoover Institute.
Yeah. So I looked at, I'm helping two students write an op-ed, and there was a paragraph in there about a course that they took, and I was so shocked. I went and looked at the course description, and it was true. The dean of the school is teaching a class where he has the students undergo an analysis of what individual behaviors, like taking shorter showers, could do to help us reach our carbon emissions, which is an industry talking point. Yes. The dean of the school also spends a lot of time talking about how carbon capture and storage is going to solve all of this, which is really not supported by history or what our investments have been. I mean, it is so, and then I'm working with another group of students on this question of what role should nuclear play. The TA is funded by nuclear and is recommending altering their research questions based on his research that says that there are certain things that we shouldn't be worried about. It is crazy,
That is crazy.
And so this is my experience at Stanford. God only knows like what these oil lobbyists were saying that is really in the interest of prolonging their industry and is contrary to what the science is telling us of what this is doing to our planet and to our health and to our future. It is deeply disturbing.
Of all the institutions that have been captured by the petroleum industry, I mean, Stanford ranks in the top 3.
Yeah. And I mean, what's really disturbing, right? Talk about greenwashing. I mean, the Doerr School of Sustainability, some of the brightest minds right in the country who are basically being brainwashed by this industry. It's really disturbing.
Wow.
No, that is really, terrible. And I feel like I recently read a book, I think it was Michael Mann, The New Climate War. Not very objective, but very good. But it talked about how like the industry is kind of pushing individual action as the way to change the footprints that we're all creating. But as we know in this room and those that will be listening, it is systemic. It is systemic, it's defunding, it's all of this, it's all of our work together, and it has to come from the top.
Yeah.
And individual efforts, but individual efforts are not key here. So that's disheartening to hear that this is a class and that these.
But it should light. I mean, it certainly lit a fire in me. I canceled my morning, and I'm going to Stanford for the next talk where they're going to be heavily industry represented people that are going to promote Stanford maintaining its ties. And I'm going to try to bring any other white coats with me. Do you know what it's like to counsel a mom who's in premature labor during wildfire or heat season about what it's like to give birth to a premature infant when we know that heat and wildfires are a risk? Let me tell you what that's like,
Right.
Yeah.
You'll have to circle back and let us know.
I'm so mad.
No, it's good.
Well, you would think the orange skies of 2020, might have had an effect on those in the Bay Area, but obviously not a long-lasting one.
It's so, I feel like we live in this world where information moves so fast, then there's too much of it. And so I really think it's hard for people as these events come and go for it to be really sticky in terms of what the cause is. Hold on to it, right? And so and like, let's not forget either that there are 2 candidates for office, and one who we were starting to put together the consortium is embedded in an academic center, and so we are non-political, nonpartisan. We are trying to put out some thoughtful resources during an election year. And one of the things we can do is put out just a description of what actions a candidate has taken or quotes from each candidate on an issue. There were plenty of quotes that I could have provided for President Biden, plenty of speeches where he talks about climate change. The only quote I could find for President Trump was "drill, baby, drill." And so we've decided not to put forth a candidate guide because the contrast
Right.
makes us look political, but the reality is that there is one candidate who has taken thoughtful, science-based action on climate change, and there is another candidate who is not.
Yeah.
And that is
Right.
somewhat the reality.
So Lisa, you
Right.
mentioned preterm birth, and that brings up, I'm going to pivot now too, Allie, and that brings up a topic that's near and dear to my heart, which is I lecture on the intersection of the maternal body and the effects of fossil fuels and the climate change that they're responsible for externally, but then also all of the pollution that's happening and is affecting our maternal bodies on the inside. And so we saw 2 weeks ago a study by Lawrence Tressad at NYU Langone, showing that phthalates actually, which are a plasticizer, they make our plastics more flexible, are responsible for 1 out of 10 preterm births in America now. And obviously we're looking at the literature showing increased cancer rates in people under 50. But in my area, in maternal health, we're seeing a lot of intersection of fossil fuel contaminants. There was a study that came out last week showing a new way of looking at placentas, and of 63 placentas, all 63 of them had microplastics in them. And I'm curious because I'm curious what the consortium and you are interested in terms of fossil fuel products, specifically plastics and their inherent chemicals effects on the human body, and whether or not that's something that you guys are interested in sharing with the public in a way that hopefully helps to inform them as well.
Yeah, so we have not done a lot of work in the plastic space because we've really been focused on air pollution, fossil fuel pollution, and the effects of climate change. I will say the more I learn about, I was on a panel with, and I can't remember the name of this organization, but they work specifically on plastics. And I guess what I didn't really understand is that plastics is their plan B.
Exactly.
And so we can't,
Exactly.
yeah, we can't really take on the fossil fuel industry without taking down both their plan A and their plan B. We don't, to be perfectly honest, we don't have a strategy yet on it, but I do think it's something that we do need to evolve to and take on, both because it's their plan B and because the health effects of it are terrible. So I studied evolution in college. And so I have a lot of interest around like what the Earth has looked like in the past and what it will look like in the future. And I think rather than call this the Anthropocene, we should call it the plastic scene because
Yeah.
when we go millions of years into the future and they look back on this era, there will be a thin film of plastic that binds this era because it doesn't break down, right? And this is what we want our legacy to be. You know?
Yeah, well, that Matt Simon in his book on microplastics, that's what he calls it too, is the plasticine. And actually, a study came out yesterday showing that they found microplastics in sediment going back to 1750. And what the authors of the study said was, of course, plastics weren't around in 1750, but that they have infiltrated that the ground and the ecosystem so severely that that they're geologically going back and penetrating past time.
Yeah, and I actually, when I arrived in DC for our annual meeting, the first big thing that I saw was this big ad from Plastic saying, we care about the future, and we're working on recycling plastics more. And I'm like, BS.
Right.
Well, and I wanted to ask one other question, then I'll turn it back over to Allie, and that is, I feel like when you hear people talk about technology and you hear people talk about the advancements of the 20th and now 21st century, And you hear about where we've made the best possible progress. Medicine is always, mentioned. And yet medicine wouldn't be where it is without fossil fuels and without plastics. And I'm just curious, why do you think that attitude is part of what gives the public and the policymakers a mental pass when it comes to healthcare's own greenhouse gas emissions and own plastic history? I mean, as Ali is showing in her work, the plastics industry cannot sell enough single-use products to medicine. And yet very few people are asking, wait a second, is that promotion of plastics within healthcare the right thing for the health of the population?
So these are difficult questions that I think could get to, like, what is our obligation to each other now? And there's I believe, like, an indigenous teaching that the action you take today, you have to think about 7 generations in the future and what that effect is going to be, right? One of my friends works for this big multinational corporation, and she likes to sort of boast that there are so many things about our society that are better. Arguably, you can say that we're in this moment where there is more wealth, there's more access to sanitation, there is more access to housing than there has been, lesser infectious disease. There are many advances that we've made. But what I like to tell her is that all of that is on the backs of future generations. Like, yes, fine, we can celebrate where we are in this moment, but none of it has been sustainably achieved. And the future generations are going to have to pay this price. And so that's the question we have to ask ourselves is, okay, great. It's great for us today, but what is our obligation to our future generations? And I think most of us agree that it's our obligation to leave the world a better place than how we found it. So we used those innovations as we needed in the moment to make the advances that we've made. But we as a species, right, like, part of our strength is our ability to be creative and innovative. Now, here's where I'm going to stop because I'm not a mechanical engineer. I don't know what those innovations can be, but I know that if we can ground ourselves in the value of reuse and respect, for each other in terms of not creating polluting industries, and for this earth, for not polluting the earth that ends up back into our bodies, I know we can arrive at solutions that will be better all around for all of us. And I think that should be our grounding value, 7 generations in the future.
I love that so much. Reuse and respect. I wrote that down. I'm going to remember that, Lisa. So, we're getting to our time here. If you have 2 or 3 recommendations, I know, most of us are OB-GYNs, but I've listened to radiology talks, I've listened to pediatrics talks. What would you say to the healthcare providers who are listening that we can do?
I would say find a buddy. So join this group, for example, join one of our state clinician groups, join a PSR chapter. There are so many opportunities don't do this by yourself. You will
PSR is Physicians for
Social Responsibility. So the consortium is in about 25 states, and PSR is in about an additional, I think, 20 or so. But or Citizens Climate Lobby or something. But we are social creatures. This is an enormous problem. You're unlikely to get anywhere, and you are certainly unlikely to last unless you have a buddy system. So find yourself a buddy, find yourself a group, and start there, and commit yourself to that group. And if you don't like that group, consider it like dating. Find yourself a group that you do like, people that you do like to advocate with. And once you find that group of people, the sky's the limit in terms of what you can achieve and what you can accomplish. So that's what I would say. People often ask me, like, what's the one thing I can do that's going to have the most impact? And usually they want, they're thinking about things like, should I eat less meat? Should I install solar on my rooftop? Should I bike more? And I'm like, okay, yeah, all those things are fine. They're great. More important, though, is talk to others that you're doing it, that you're concerned about climate change. Find yourself a buddy And please vote. For the love of God, please vote.
Yeah.
Because climate change, and get others to vote too, because climate change is a systemic problem, Allie, to the point that you alluded to, and it needs systemic solutions. And if we have elected leaders who don't understand the importance of science and don't respect it, there's no way we can thoughtfully address the climate crisis.
That sounds really good.
Irene, do you have any questions for Dr. Patel?
I have a question and comments. Thank you so much for the talk. Could you just explain what COP is? Because I'm not familiar with that acronym.
Yeah, it's the Conference of Parties, and it was where, for example, the Paris Climate Accords came from. Every year, it famously was what Greta Thunberg said was blah, blah, blah. And so, it used to be, from what I understand, when it started, it was a few hundred folks. It's grown to thousands. It's become really a big circus and more oil industry is coming in, as I think more and more activists and other concerned parties are coming in to say, we're not moving fast enough. But this is every year, COP rotates to different countries, and all these countries and stakeholders come together to see where we are in terms of progress from the Paris Climate Accords, and what more can we do, or what more can we deliver on. So it's an opportunity to really press. So for example, for us as health professionals, we really wanted to press the point that we're not talking enough about health, we're not centering enough on health, we're certainly not investing enough on health. And so we've made some big progress, particularly on that front with, we started to make some inroads in COP26 and COP27, and COP28 feels like it was the big moment by having a health day, for example.
Great. And I was impressed with the issue of engaging leadership. I think that's one thing that I can start doing in terms of having them endorse, support, and promote some sort of action. I'll make it my little mission to spread the word. I'm an alumni of the University of Arizona Andrew Weil Integrative Medicine Program. I'm a graduate of it 10 years ago. I can use those contacts to spread the word, because that is a receptive audience. So lots of communication in store.
Yeah, and if you go to the consortium website, we'll be doing a formal launch of some materials. We're doing another push to get institutions to sign the Health and Human Services Pledge. We've also come to understand that in certain states, a pledge that was introduced by the Biden administration can be toxic. So we are introducing some other materials if the pledge isn't something that your leadership is going to be receptive to, some other asks that are not associated with an administration, just to create some flexibility in terms of who your leadership is and what messaging they might find the most resonant. Last thing, resonant messaging. One of the ways I think we need to frame sustainable healthcare is that healthcare feels broken. It feels like we've lost our way. And so sustainable healthcare isn't one more thing to do. Sustainable healthcare is how we need to reframe and reinstill healthcare with a moral purpose that gets people engaged and makes people feel fulfilled and makes people feel proud of their institutions, that they're doing the right thing to not just take care of their patients and their communities, but doing the right thing in terms of taking care of the world. And I really think we need to move away from this frame of like, here are all the things we want you to do, to here's a way that we can reimagine our healthcare centers to reinstill people who came into this wanting to feel good about the work that they did. And here's this concrete that we think that we can do to help reinstill that sense of moral purpose and charge.
It just so happens that the motto of the Stanford Health Medical System here is Health Reimagined. So I think that plays in very nicely to your comment.
I mean, when you were a part of the OB, I was listening as I was coming. Where did you do your practice?
In Stamford, Connecticut.
Oh, Stamford. Oh, I thought you said Stanford.
No, it's Stamford, Connecticut.
Oh.
So it's our center is doing really well in terms of establishing its catchment area, its network, its strengthening subspecialties. Our residency program in OBGYN has increased to 4 residents a year. Many get fellowship placements. So I just think we need to work on this area, and I find that administration needs a lot of re-education.
Yeah.
They do, but I
Great.
think that those thoughts, Lisa, are really a really nice way to close that, you know, we're reimagining healthcare. You know, I personally feel reinvigorated and passionate because I've been doing this research and I found this research and I love being a doctor. I love taking care of my patients. However, I have this higher purpose that I feel like I didn't have so much in residency. You know, it definitely drives me so much more than I ever thought. And so putting that out there, you know, it is a joint mission, and you know, we know how to fix it. We know how to fix healthcare. This is it. So thank you.
Yeah. Thank you for having me.
Thank you, ladies.
Thanks, Irene,
Great,
for
thank you.
coming.
Yeah,
Thank
thank you
you.
so much.
Yes,
Yeah.
would it be all right for me to share some of your slides from your ACOG presentation last May? Because even though I just retired, I went to the annual clinical meeting and I thought your session was just amazing. And I had some of the slides. Can I share some of that
Oh,
with?
yeah.
Great, thank you.
Put my slides anywhere.
Okay, great. Thank you so much because they were robust and it was just an amazing presentation.
Oh, thanks. All right, I will end the recording.
And we'll get this up on our website. Thank you again for your time, Lisa. Really
my gosh.
enjoyed talking to you today.
I feel so embarrassed that I was like 12